More than 15 million Americans are diagnosed with atopic dermatitis, commonly referred to as eczema. The chronic inflammatory disease that affects 90% of patients within the first 5 years of their lives is characterized by red, dry, itchy skin that rashes. This uncomfortable and unpleasant condition largely affects children, but can also affect adults and often leads to sleep interruption due to the severity of the itch. While the cause of eczema is unknown, doctors say it can result from genetics, environmental factors, or an overreactive immune system. While many products to treat eczema are currently available, the FDA has recently cleared a new approach in managing the signs and symptoms of eczema called Mimix cream.
Our goals in managing eczema are basically twofold. First of all, we want to relieve the signs and symptoms of the disease, and secondly, we want to try to rebuild the skin barrier that is usually compromised in individuals with eczema.
Mimix cream, manufactured by Stiefel Laboratories, offers doctors flexibility in tackling eczema.
Unlike current therapies for eczema, Mimix offers a new approach for treating eczema. It has a dual function to both rebuild the skin barrier and to reduce the signs and symptoms of eczema. Basically then, we found that Mimix essentially mimics the natural components in the skin barrier and has been found to be safe and effective.
Although it can affect adults, eczema largely targets children, with 90% of patients developing symptoms before the age of 5. But unlike current prescription therapies, Mimix is safe enough to be used on patients of any age, and there is no limit on the duration of use. The new therapy is currently available by prescription only. I'm Danielle Adair. Important safety information. Mimix cream is indicated to manage and relieve the burning and itching experienced with various types of dermatoses, including atopic dermatitis, allergic contact dermatitis, and radiation dermatitis. Mimix cream is contraindicated in patients with known hypersensitivity to any of the components of the formulation. In radiation therapy, Mimix cream may be applied as indicated by the treating radiation oncologist. Do not apply 4 hours prior to a radiation session. Mimix cream does not contain a sunscreen and should not be used prior to extended exposure to the sun. For external use